In this video, we will discuss about stem cell therapy, a basic idea about stem cell therapy. Before going into this, we will quickly understand what is stem cells. Stem cells are considered as the cells that can be differentiated into the any kind of cells under specific growth factors and uh, certain conditions. So that is why stem cells is considered or are in the centered part of research nowadays, because people have find out a way to uh, reverse or to convert any kind of cells back to the stem cells and then differentiate them into the desired kind of cells with a committed function. So what are the 6 stages of stem cell therapy? First, the stem cells that are usually found in bone marrow are taken from the patient, and then uh, it is usually taken with the help of blood. Then from the blood, the stem cells are being separated out, and then after these stem cells are being separated out, they are being uh, differentiate to form a final product or to final committed cells, and these committed cells can then be used to again form the stem cells. And because the growth factor that are being used in first step are might be different to get a healthy final outcome cells, and when the final outcome cells is moved back to the stem cells, they can now be identical or similar to the stem cells that are found in healthy patient. These stem cells, these frozen stem cells, are need to be returned to the body, and in order to make sure that these stem cells are being absorbed by the body, we need to do further chemotherapy to wipe out the bone marrow and weaken the immune system. And then stem cells are being returned into the body using in a very slow manner, and the body recovers of all this chemotherapy and able to absorb the new stem cells, and that might take around 3 to 6 months. So this is just a proposal. This thing is yet to be well established. There might be a possibility that more challenges might occur while executing this strategy. So let us now understand one of the easiest or one of the most prominent future possibility from the stem cell therapy is the treatment of osteoarthritis. So in osteoarthritis, the major problem is that it uh, the cartilage in between the joints does not have blood vessel. Because of this, it is not able to because of this stem cells are not able to migrate to this cartilage, as for the migration of stem cells, most of the time uh, blood plays an important role, and because there is absence of blood vessels, stem cells won't be able to migrate to the cartilage. And that is the reason that in the later stage of life, when the cartilage break down, people might not be able to regenerate cartilage on its own. So one of the reason is lack of uh, lack of stem cells at the site of injury, or another reason is that stem cells are low within the patient. So in order to deal with both the cases, what people have suggested is to artificially introduce stem cells at the cartilage with the help of injection, uh, so that stem cells can now regenerate or differentiate into the cartilage cartilage cells that are similar to cartilage in terms of mechanical strength, and uh, also the flexibility of the cartilage cells. Because at present, the replacement of this cartilage is not it does not have the properties similar to the original cartilage. For example, the flexibility of the cartilage is low compared to its original form. Because of this, the wear and tear of the artificial cartilage is more frequent, and people have to people have to face these problems uh, in a short duration of time again and again. So with the help of stem cell therapy, it is possible that uh, with the treatment of just one with a treatment of this osteoarthritis just one time will help the patient to not face this kind of problems in the near future. So that is the reason the stem cell therapy, that is the one of the examples of the stem cell therapy in the nearest possible time. So that's all for this video. Thank you for your time.